Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. I'm so very pleased you could be with us for this next segment. Wow, Dr. B. Epstein Shepherd, medical hypnotherapist.
Yes.
Dr. Epstein Shepherd, thank you so very much for coming on my program. This is another segment where I'm going to learn a lot. I want to learn a lot about what you do and how it helps people and patients. Before we get to that, I want to talk about your background. So tell me from whence you came or from where you came.
Well, I have a PhD in psychology, and then later on, actually, this is my second career. I was on the faculty of various colleges and universities teaching business. I was a corporate trainer and worked conducting seminars internationally. I presented in more than 450 cities internationally, mainly talking about stress management and life balance. And this was kind of an introduction to getting into hypnotherapy, which is something that I've always been interested in. Even as a child, I read a book called Mind and Body, Psychosomatic Medicine by Dr. Flanders Dunbar. And I was just fascinated by the relationship between the mind and the body, between our thoughts and our sense of well-being and our health. And so I played with hypnosis, did a lot of reading in hypnosis and played with it for myself, learned to hypnotize myself many years ago and worked on myself using hypnosis. I was aware that hypnosis was used, for example, in mitigating pain, and I actually decided to become a hypnotherapist after I lost my husband to cancer. And at that time, I didn't know how to hypnotize others. I knew how to hypnotize myself, but I didn't know how to hypnotize others. And I decided to make a life change at that time. That was in 1992, and I became certified as a hypnotherapist. And a couple of years later, I was off the road doing my seminars and focused on hypnotherapy. And over the next few years, I kept studying, taking more classes, and it took me 7 years, but I eventually got a DCH in addition to my PhD, and the DCH is Doctor of Clinical Hypnotherapy.
Right, and I read that's through the American Institute of Hypnotherapy, and you
Right.
got that DCH in 1999.
In 1999.
Right. You know, Dr. Epstein Shepherd.
You know, most people call me Dr. B. It is so much more efficient.
Dr. B.
Yes.
Well, thank you for telling me that. I'm happy to call you Dr. B. I recall, something you said reminded me, I recall my dear sweet mom, when I was young, gave me a book called Cybernetics.
Yes.
Which is a lot about positive imaging and giving yourself feedback and giving yourself positive reinforcement for accomplishment. And it influences me still today. So it's amazing what continues to influence us, those experiences as young people, don't you think?
Yes, and the author, Dr. Maxwell Maltz, was a plastic surgeon.
Well, Dr. B, see, you're teaching me more. I didn't know that he was a
Yes.
plastic surgeon. I'm going to go
Yes.
back and look for that book.
Right.
So you're a doctor of clinical hypnotherapy. So what I want to do is learn about what your day is like and learn what you can do for people and patients.
Okay, I'll dispense with getting up and having breakfast, although that's an essential aspect of one of the programs that I work with, which is called Youthing, a Hypnotic Approach to Anti-Aging. And I think it's quite a coincidence that I'm here today.
Yes, perfect segue.
Right after Dr. Wilson.
But you know, Dr. B, let me back up for one moment.
Yeah.
You said that when you were in industrial psychology, you talked a lot about life balance and
Yes.
stress management.
Yes.
Now that, we're going to get you back on this program another time just to talk about that. But can you summarize some of your work from that period?
Yeah. I did a tremendous amount of research on stress, mainly because one of my dear, dear friends was diagnosed with cancer in 1977. I was with her during that diagnosis, and what was mentioned at the time was that cancer seems to be related to stress. Now, my friend became, who was a therapist, began to work with people and stress, and so did I. And the more I researched stress, the more convinced I was that there was a direct relationship between stress and so many of the physical illnesses that we have. And this has been proven by the research in terms of the changes in the hormone levels, which Dr. Wilson already talked about. And because when one's stressed, the immune system is impaired, and when the immune system is impaired, then one's open to far more diseases. We also know that exercise is one of those things that really lowers stress. It's one of the best stress reducers there is, and so it's nice that I'm here just as my barber was here. But exercise is one of those things that reduces stress. And there are a number of other things that reduce levels of stress, one of which is nutrition. And so by using exercise and nutrition and using the mind to change the way we think has a huge impact in lowering stress. When we lower stress, the body is strengthened and you're not nearly as subject to disease as when you are under high levels of stress. So for years, and I've done programs on stress management and published on stress management, I worked with stress management and teaching people to balance their lives in such a way that their stress levels came down. And part of that was including proper nutrition and breakfast and exercise and changing the way they think as a road to much better health in every way. Well, it was kind of a natural progression then to discover that hypnosis is absolutely the fastest stress reducer, and I can bring down a person's stress level with hypnosis in approximately 10 minutes or less, and teach people to do it in a matter of minutes. So you can learn through hypnosis how to lower your stress level in just a matter of a few minutes.
Well, that's amazing. So let's get back to what your average day is like as a hypnotherapist.
Okay.
So do you see new patients in your office? Do you have returning patients? Do you counseling over long term? Do you see people in repeated sessions? How does your practice work?
It is very, very individual. There are some people I see once. I've had people who have had a tremendous fear of needles, who I've seen once and have overcome their fear of needles. And that might take an hour and a half. The chances of seeing them again, if that's their only issue, is pretty slim. I'm currently, this morning, I saw a client that I'm working with weight control. She's had a problem with weight control for almost her entire life. That's not just a matter of eating less and exercising more, because we know that's what you have to do. But there are psychological underpinnings to binge eating and overeating. So working with her through hypnosis, we're discovering what are the stress factors, what are the underlying issues that have created her desire to overeat at what times. So this particular client, and I have a few clients that I might see once every 2 weeks, over a period of maybe 3 months, to use hypnosis for weight control. And the research has shown that when you use hypnosis to supplement or support any weight control program, the success rate is approximately 90% higher than when you don't use hypnosis, and the long-term keeping it off is approximately 146% higher than those who don't support weight control with hypnosis.
So it sounds to me like you're suggesting that your state of mind and your way of thinking can profoundly influence your physical health.
Oh, absolutely. Absolutely. And as a matter of fact, talking about my day, tomorrow I'm seeing a new client who has recently been diagnosed with a severe form of cancer. The first thing I'm going to do is lower her fear of needles, get rid of that anxiety, because she said, I'm really terribly panicked about the chemotherapy and needles. That is something that can be handled in a short period of time. When I talk a short period of time, depending on what it is, I would say less than 2 hours. And I have worked with others, a number of clients. I call them clients instead of patients because I'm not a physician. So I've worked with a number of clients who have had this fear. I'm amazed at how prevalent the fear of needles is. To me, you get a shot and it's a nothing. As a matter of fact, when I go get my flu shots, the person always says, "Are you okay? Are you okay?" Why shouldn't I be okay? Well, because so many people faint or get lightheaded or a fear, and it never occurred to me. Although working with people, I know they have the fear, and we can get rid of that fear with hypnosis in a very short period of time.
Well, Dr. B, I have a professional question.
Yes.
In my practice, I give people options of going to the surgery center or the hospital for a general anesthetic for an elective surgery such as eyelid tuck or a neck lift, etc. They also have the option of just getting lightly sedated, or they have the option of having something done with a mild oral sedative and local anesthesia. They get numbed up. Is it possible that if people are nervous about the procedure but prefer to have it done while they're awake under local, that you might assist with that?
Oh, absolutely.
So would you see a person like that? You'd see them ahead of time,
right?
Not during the procedure.
No.
So you see them ahead of time, and tell me what that might be like.
Okay. We look at the fear, the anxiety. We have a conversation and look at the fear, and then I hypnotize them and I record it. Put it on a CD, lowers their anxiety level. All they think about is a positive outcome, feeling relaxed. And we have research, there's a lot of medical research that shows that those who do that prior to surgery are much more relaxed. The surgery is easier, their muscles are relaxed. You're also able to direct blood flow away from the site so that it's easier for the surgeon to see what he or she is doing. And then I also do another part of the total surgery, which is waking up feeling refreshed, feeling less pain or no pain, coming out of the anesthesia much quicker, and actually healing faster. And the surgery patients that I have worked with, every single one of them has healed faster, come out of the ICU faster, come out of the hospital faster, or rehab faster than their physicians told them to expect.
Well, it sounds like it's good not only for the client or patient, it's good for the doctor.
Right, and there's research that shows, there's also research that shows that it's less expensive for the healthcare facility because surgery is faster.
Oh, okay, now Dr. B, I have kind of a tough question for you. The audience knows that I'm board certified. I'm Western trained, universities, etc. So I'm science-based,
correct,
right? So perhaps this is a tough question, but I want to know if we have science, real science, to back up the treatments you administer or the way that you're trying to help people. Like, I'm totally in favor of people feeling better and they're more relaxed, etc. But when you say that we can actually influence the outcome, do we have good science that predicts that or can describe that?
There has been work done at Harvard and a few other places that has shown that, actually, I believe it was Dr. Carol Junitis. There was research done on bone healing and also on healing from breast cancer that showed the healing process actually was faster than without the hypnosis. So yes, there are these kinds of studies. And one study that I read recently was a meta-analysis of 20 research studies on the impact of hypnosis in the surgical procedure, and they found that was an 89% positive outcome or more positive outcome. The group that used hypnosis had a more positive outcome. So there is work being done. I might mention that about a year and a half ago, I was talking to the research team that worked on telomeres. Elizabeth Blackburn won the Nobel Prize for this research, and they were actually interested. I suggested a protocol to test whether hypnosis could lengthen telomeres, and I believe it can, but it's only a belief. But they were very interested in the research and would have liked to do it, but there's no funding for that kind of thing because there's no way to control.
Right. Dr. B, that's really fascinating. Now we have about 45 seconds.
Okay.
I want to make sure I give out your phone number, or you might have a website, and
Right.
we want to know where you're located. So if people are more interested in hypnotherapy, where can they go? Or what do they call?
They call 625-3188, or they go to my website, and it's just Dr. B with 2 E's, DRBEE.com.
Wow. Okay, now I'm going to
That's
give out that information again. So we're with
Okay.
Dr. B. Epstein Shepherd. You're a doctor of clinical hypnotherapy. The phone number is 831-625-3188. I'm going to say that again, 831-625-3188, or drbee.com, DRBEE.com. Great,
Right.
great website. Well, Dr. B, this is fascinating to me. We're going to have to continue this discussion again. I think it's amazing. We have just a few seconds. What about for addictions? What about for smoking, drinking heavily, other illicit substances? Can hypnotherapy help, or is it a waste of time?
No, it can help if somebody is absolutely determined to stop smoking. Hypnotherapy can help. I have worked with people who have wanted to limit their alcohol. Those are some funny stories, that they didn't want to stop drinking completely, but they wanted to limit their alcohol to maybe 1 or 2. And then I work with that in a very short period of time, and the third drink they just are no longer interested.
Well, Dr.
So,
B, thank you so very much for being here.
my pleasure.
This is Your Health television program. I'm Dr. David Morwood. I'm a board-certified plastic surgeon. Thank you so very much for being with us today. Please tune in again.
Making your life a more healthy one. For copies of today's program,